Lowe's department store has almost 9,000 employees at 295 locations in the Bay Area and around the state. But the Bradenton-based company says it could very well give jobs to more Florida residents if not for the exorbitant amount of money it spends on prescription drugs in workers' comp cases.
Everything that we're seeing that we're paying on an increased scale is having an impact on whether or not you can hire somebody.
The I-Team has discovered a loophole in Florida law that allows doctors to give prescription medication to patients in workers' comp cases right out of their office. It doesn't cost the patient a dime, but it costs their company and us taxpayers millions of dollars a year more than if those same patients just went to their corner pharmacy. So-called drug repackagers like Ohio-based MedX Sales are pitching their services to doctors like this.
You can substantially increase your revenues without having to see additional patients with MedX Sales' simple, easy, and highly profitable dispensing and mail-order drug solutions.
While Florida limits what pharmacies can charge for prescription drugs, no limits are placed on repackagers.
They charge $860 for this package of Lyrica. We charge about $280.
Steve McDonald is CEO of MyMatrix, a Tampa-based business companies use to help manage benefits programs.
And by virtue of taking those pills out of the big bottle and putting them in a new bottle, what the companies end up doing is inflating the price of those drugs by as much as 600 or 700%.
Here's another example.
This is another drug, meloxicam, a drug that we charge about $40 for, that they charge about $280 for.
The Workers' Compensation Research Institute says the loophole allowing repackagers to do this costs Florida businesses an estimated $34 million a year. So, why doesn't the legislature simply close the loophole? The answer, one expert says, is money. Joe Paduta writes a well-known weblog dealing with managed care issues.
What they've done is they have so much money that they're able to use that in lobbying and in supporting different politicians.
For example, from 2005 to 2011, Miramar-based Automated Healthcare Solutions contributed over $3 million to Florida politicians, including former Governor Charlie Crist. Crist vetoed legislation just before leaving office that would have closed the loophole. Crist didn't return repeated calls for comment. As for Automated Healthcare Solutions, the company referred us to the testimony this week of Dr. Gary Kelman before a legislative committee considering a new bill to cap profits.
So it's not about doctors making money or gouging the system. We don't make money as being pharmacists. We make money by treating patients and getting good outcomes.
Florida is one of 13 states allowing physician dispensing. Joe Paduta says it's a questionable practice at a time when so many are concerned about the ever-increasing cost of health care.
And nobody begrudges anybody else making money, but one has to understand where those dollars come from. If it wasn't going to those entities, it would be going towards hiring more teachers, reducing people's taxes, hiring more workers.
As for the latest attempt to limit the astronomical markups on these drugs, the bill to do so made it out of committee, but when we asked the governor's office whether he would sign it, they couldn't even tell us whether he supports the idea of capping sky-high profits on physician-dispensed drugs. I'm I-Team Chief Investigator Alan Cohn, ABC Action News.